Hello listeners, welcome to Off the Cuff, and today we will be talking about health and wellness, aging, looking and feeling great by taking care of your body and mind. And I do have a very accomplished guest here with me, Dr. Lori Bluvas. Welcome to Off the Cuff.
Thank you for having me. I really appreciate being here.
It is my pleasure. A little bit about Lori. Dr. Lori Bluvas is the CEO and co-founder of Biohackr Health, which opened its doors in 2021 to improve access to evidence-based cutting-edge therapies that support health and wellness. As part of the Biohackr Health team, she helps patients explore innovative therapies that support anti-aging, hormone balance, and whole body optimization. Her approach is rooted in science and guided by advanced testing with treatments tailored to common concerns across all life stages. Besides that, Dr. Bluvas is a board-certified OBGYN who has been treating patients in the Bay Area for over 25 years. She is a graduate of Brown University at the University of Minnesota Medical School and is currently affiliated with UCSF and Sequoia Hospital. Throughout her career, she has received numerous awards recognizing excellence in teaching, patient care, and clinical leadership. So a lot, Lori, there, and what a wonderful career.
Thank you so much. I appreciate it.
So now on to Biohackr Health.
Yes.
What motivated you to, start this?
Well, I think as my cohort began aging, we started thinking about medicine more in the context of addressing aging as a disease, as opposed to diabetes, high blood pressure, etc. And at that time, there was a lot of emerging therapies to address aging at the cellular level. So we co-founded Biohackr Health as a way to allow access to these therapies, to motivate us to investigate these therapies with more scientific rigor, and to be able to bring these therapies to our patient base.
But talking about biohacking, can you just, specify what biohacking means?
Right. Well, we think of biohacking as anything that improves our body's function in the context of regenerative medicine. So in the broad term, biohacking could be all of medicine. You know, we're using medications, peptides, regulators, hormones to alter our body's function. But with biohacking, it's more for the wellness optimization piece as opposed to the preventing illness piece. So addressing aging at a cellular level to sort of get in front of these changes before they start to have too much detrimental impact.
Okay, and obviously it's technology based and it's scientifically experimented before you start these therapies.
This is true. A lot of the therapies that we use are FDA approved. For example, just estrogen replacement in women. We use the GLP injections for weight loss. We use testosterone in men. So a lot of FDA approved therapies that have been tested, for many, many decades. We also have, data that is tried and true data, your basic blood work. But we also have things that are sort of on the cutting edge, say cancer screening using blood samples, genetic cancer screening, other VO2 max measurements, and other sort of micronutrient analysis. So things that aren't necessarily in the medical mainstream, but we feel with our chief science officer that this is an important piece for wellness. So we kind of blend new things coming down the pipeline and then kind of the old established FDA approved therapies.
Yeah, and it's very individualized, each person.
It's very individualized. We do like to start with extensive blood testing, and we review those blood tests with you. Tests that look for inflammation, tests that look for pre-diabetes, tests that look for hormone imbalance, and then we design a program that makes sense for you. Some people, their cholesterol and their coronary calcium score and their cardiac risk is clearly their number one concern. For other people, particularly our male clients, low testosterone can be a very medically significant issue.
Yeah.
Men with low testosterone can have higher rates of dementia, they have higher rates of coronary vascular disease, and so figuring out where your baseline is with regard to your vitamin D level, your thyroid level, your iron level is really important in terms of designing a plan for you.
Very true. And I did go on the website. Listeners, please do go to biohackr.health. Bio spelled like BIOHACKR. Biohackr.health. Look into the services they are providing, and if it's an option for you, I will highly recommend to just at least give them a call or visit. They have 2 offices, one in Palo Alto and one in San Francisco. Yeah. So wherever you are closest, you can just go visit, and I'm sure they'll also give you online help also initially.
Yes. Yeah, we do have contact form on our website, so people can initiate contact that way. A consultation in the clinic is always a great way to start, so people can see the different sort of modalities that we use, and the options are right there for them. So,
like you suggested, there is. It's backed up by science and data. What are the most common concerns of your clients? Because you started it in 2021. It's been almost 4 or 5 years.
Yes.
What are the common concerns that you guys
That's
deal
true.
with?
Our 5-year anniversary will be this February, so we're very excited about that. 5 years. And a lot of people think, Biohackr is for these highly optimized people. But the truth is, we see regular people with regular problems. And a very common person that would come into Biohackr is somewhere between 40 and 55. And things have just gotten a little bit away from them as they health-wise, and as they've been dealing with their children and their careers and their families, and now they realize, oh, I'm not feeling great anymore. And they have a few extra pounds to lose, and perimenopause is there, and they want to sort of figure out, what might be going on and what can we do to address this. So for a lot of people, that is starting with weight loss. We do body composition analysis so that we can get an idea of what your baseline lean muscle mass is, and what your baseline fat percentage is. And as we go with you through this weight loss program, however it's being done, whether with GLPs or hormones or other kinds of peptides, we can continue to monitor your body composition so we know that you're doing this healthy. What has happened with weight loss over the years is when we lose that weight, we lose fat mass, but we also lose lean muscle mass. And then when we gain the weight, we're not really gaining back the lean muscle mass. So you really have to have the data telling you, if you lost 5 pounds, but 3 of it was muscle and 2 of it was water, this is not serving you in the long run. So I would say weight loss is probably maybe the number one thing that we do. And hormone replacement is the second thing that we do in terms of which things are done most commonly.
And I do see, as a woman from 50 to 55 or 60, you see a drastic change in your body. I mean, in terms of weight, in terms of skin care, in terms of mental, how we can deal with it, and also a lot of sexual health too. It's a vast difference that you feel, and sometimes you get overwhelmed with everything. And that's why I will say, do look into Biohackr .health and see if they can help you out. So one more thing, can you, without naming, can you tell us any story or of a client that you, helped recently.
Recently.
Yes.
Yes.
Yeah.
So we do have a lot of women who come to us with these softer signs of menopause. Things like brain fog that you alluded to.
Yes.
Things like joint pain. Things like libido. So the classic menopause things, hot flashes, night sweats.
Yes.
Maybe not so much, but on that other end where you talk about, energy level, exercise endurance, they're coming to us for treatment with that.
Okay.
And so for some of these women, we will, so I'm thinking of one woman in particular with this, we will diagnose with their blood work, yes, you are in perimenopause, but you also have a thyroid disorder that was uncovered. You also have vitamin D deficiency that was uncovered. You also have, elevated cholesterol, which we want to deal with later. So when you talk about it being, very complicated in terms of the problems you have, brain fog, weight gain, sexual dysfunction, it's also very complicated in terms of the approach. So I think that it's important to have a guide. And we do have registered nurses that are at Biohackr. Many of them have been there since the beginning with us. And they operate as a very good guide to help you with, let's fix the vitamin D, let's address the hormones. Could take a while for the hormones to help with the skin and the hair. So we do have other regenerative medicine things sort of in that beauty bucket. So, a middle-aged woman coming to us with the constellation of problems, we see very commonly. And being able to address them with hormones and just an identification of all the factors that may be contributing, I think is very rewarding for us.
Okay. Yeah, I'm sure. And, like your bio said, you have been a champion for women's health. And what I read also, women's health research lags behind men. And, less funding for women's health. Also, focus on men's issues are much more. I mean, they get a few more extra $1 billion for their research than women do, which is so unfortunate.
It is true.
And
my history as an obstetrician gynecologist was a real natural segue into biohacking because we have been addressing hormonal changes and sexual health changes, my entire career. And so I've been hearing these stories and mostly watching the women who were about 10 years older than I was. So when I was 35, I was learning from my 45-year-old clients what they were experiencing. And then at 45, my 55-year-old clients, and now I'm in my mid-50s. And I'm seeing a lot of my patients in their 60s really wanting to stay vital and active and engaged and cognitively involved and not be suffering from what we've normally termed aging. So Biohackr Health is there to try to address these concerns that change for us each decade.
Very true. And you are on a South Asian Indian channel here. So any particular services that South Asian Indians usually come to you for, men and women both?
Yes. Well, as we spoke before we started the interview, I have had many Southeast Asian women over the years with pregnancy, fertility, childbirth, and then ongoing wellness care. And we do see in that community a higher incidence of prediabetes.
Yes.
Even if the prediabetes or gestational diabetes.
Yes.
Even if the weight is not a great concern, the glucose sensitivity and the insulin resistance seems to be there for this demographic. And so, first of all, appreciating that with hemoglobin A1C, body composition analysis, and understanding sort of the root cause is really important. But then, some awareness and some support. I think it's very difficult when you have a chronic issue such as, insulin resistance or inflammation, to do it on your own. You do need a partner in your health to say, hey, you're on track, or you kind of, fell off track here during the holidays, but now we're going to help you get back on track, because that inflammation does lead to cardiovascular disease and frank diabetes, at some point. We also see in the Southeast Asian patients the polycystic ovarian syndrome.
Okay.
We also see vitamin D deficiency in very high amounts.
Yes.
We do vitamin D injections and iron infusions at Biohackr Health, because some people don't absorb this well orally or don't tolerate those supplements. Or if you're like me, maybe you do it well for a few weeks and then, you kind of forget, I'm supposed to be taking my vitamin D.
Very true.
So we're there to sort of help you along the way stay your healthiest self.
So you're saying like IVs and injections would work better than pills, and that's what you're...
For many people, the gut microbiome is different for all of us. And for some of us, it's excellent at absorbing things. We have iron stomachs, so to speak, and we can tolerate all kinds of, food and maybe insults to our body. And other people, their GI system is just a lot more fragile. And having the option for an IV or an intramuscular, or with hormones, we'll do what's called a transdermal route with creams through the skin. It's good to have all those options at your disposal.
So most of your patients, I'm sure they must be going to their primary or to the specialist, and then they come to you with all the data, and that's how you work with them.
Yes, this is very true. And this was part of, kind of alludes to me remembering as we named Biohackr Health. Because really, the biggest piece is the health, not the biohacker. The biohacker sounds very fun, and it is fun, but health is the biggest piece. And, if you're talking about longevity and wellness, doing your regular screening, your mammograms, your pap smears, your colonoscopies, so important. And we're very, very good at that. And we've, amassed lots of data amongst this, preventative care medicine. So it's a very important piece. And with the Biohackr Health clinicians, they also, make sure, have you beginning your mammograms, you have colon cancer in your family, your colonoscopy should be every 5 years, kind of following along, make sure that you're staying on track. But that health piece is very important. The primary care doctors sometimes are not, even though they do understand wellness and health optimization and they're on board with this, you only have so much time and so much bandwidth, So if your menopausal female patient wants to talk about sexual health, you may not, as a primary care physician, have right there in your hard drive information about shockwave and PRP and medications that are FDA approved for libido or testosterone in women. So it is a specialty in and of itself, biohacking and using regenerative medicine to improve health optimization. But it's definitely a partnership, which is why we have the biohacker and the health. The health is the biggest piece, your lifestyle, sleep, diet, exercise, preventative medicine, making sure your blood pressure is okay. That matters the most, but Biohackr is also here for that extra optimization.
Very true and very well said, I have to say. Lori, one more thing is, how can people reach you? I've already given the the website biohackr.health, and other than that, any other social media handles they can follow, or anything that, where can they reach you?
Yes, we are on Instagram, Biohackr Health without the E. So when you leave the E out, you kind of, have all of those names. We are on LinkedIn. We are very old-fashioned for a company named Biohackr Health in that we do pick up our phones. You can simply on the website call that 888 number and someone will pick up the phone. Generally someone who's worked with us for quite a while and very well versed. But one way to really be introduced to our therapies is just to come in for a consultation with the nurse. These are, a half hour long. Sometimes they go longer, and we really do a deep dive into what your concerns are, because, our therapies are driven by what is bothering you? I may think that, what is most important for you may be musculoskeletal fitness, but you may think what's important to you is, your hair thinning, and hair thinning is important, in terms of how we feel and, how we interact
it is
socially.
important, and you have therapies for beauty also. Skin, and you do the Botox and everything that is available too. And in sexual health, I think, do you help with IV and IVF?
We do interlipid therapy, which helps with embryo implantation, has been shown to help with embryo implantation. So we do have a lot of people coming to us either when they're pregnant for what we call a pregnancy IV and some anti-nausea medicine, when they get that. And we have people who come to us for therapies such as NAD prior to their egg retrieval and therapies such as interlipids prior to their implantation. But my co-founder is a plastic surgeon, also been practicing in the Bay Area for over 25 years now. And so that beauty piece with biohacking and regenerative medicine was really spearheaded by her. The plastic surgeons are very much interested in how we can improve beauty at the cellular level. And we do use these cellular communicators called exosomes, and the exosomes are labeled age 0 as a trademark, and these are microneedled into your skin, into your scalp, and communicate with our cells to regenerate them and have a more youthful, reduced aging sort of appearance or function. And so biohacking for beauty and biohacking for musculoskeletal fitness, I think, was the beginning of biohacking. And now, biohacking has moved more into the weight management, sexual health, nutrients, and that sort of thing. It's just getting bigger. Everything's getting bigger.
I know your services. I think you've covered a lot of things. And what I see a trend is that the kids are getting married or, settling down a little later or having children late. So, all these services, I think, are going to come in handy, not just for them, but for everybody, each person. Like she said, from perimenopause to post-menopause. And, anybody can go there and look into their social media handles and their website, Biohackr without an E.health. Only the question is about insurance. Obviously, you guys, it's a private clinic, you don't.
That is true. These therapies don't take insurance. My private practice does take insurance, and I'm not affiliated with Kaiser, so with the exception of Kaiser. So clients may call Biohackr Health and say, I'd like to do a telehealth with Dr. Bluvas. And then my staff from my private office does contact that person. And I see a couple people a day that come from Biohackr because they either Biohackr has identified a real significant problem in them. We have found patients who have leukemia, brain cancers, really serious thyroid disorders, really serious, hypercholesterolemia. So sometimes those people will be referred to me from Biohackr because they really need to be seen in a traditional medical way immediately. But people can actually start with me, and a lot of people do start with me, and they don't necessarily even end up at Biohackr because essentially what they have to do is the simple stuff: diet, exercise, sleep, and maybe manage their blood pressure a little better. They're not quite ready for the biohacking stuff, but just sort of learning more about their health and early steps to take. So that is covered by insurance, and some people, we've seen a lot of doctors in Silicon Valley retire of late, and sometimes it's more difficult to get in to see a provider who specializes in, say, endocrinology or gynecology. And so people will come to see me in the interim so that we can get some medication started and we can start to address the medical issues we've identified.
Yeah, sometimes the wait is so long, for a specialist that that can be detrimental to your own health.
Yes,
I have to say.
And it seems like there is a increase in autoimmune diseases, and seeing rheumatologists can be very difficult. I know the two rheumatologists that I have referred to for many years have both left practice recently. An endocrinologist I referred for many years, just because we're all getting old. I mean, we're just all getting to the age where yes, it is time to retire, and finding the a place where you can be seen expeditiously is sometimes difficult. So Biohackr will refer those people over to my private clinic, which again is covered by insurance.
Okay. Well, thank you so much, Dr. Lori, for coming on Off the Cuff and speaking to my audience here. Listeners, I hope you got a lot of information here. If you want more, do go to their website, biohackr.health, and also their social media handles. They will be happy to, pick up the phone and talk to you. And thank you, Lori, so much. And I hope to see you another time, because there's so much that you can, educate us and enlighten, us with. But for now, take care and be well.
Thank you. Thank you for having me.
My pleasure.